Today's topic, what do I use on my 61, almost 62-year-old skin on a daily basis? Now, this is not for you to follow my regime because my regime is formulated for my skin. But people ask me all the time, so here we go. Given that 2 years ago I looked older than I do today, chronologically we are getting older every second of every minute. So this skin rejuvenation didn't happen overnight. It took 2 whole years. 2 years of consistent skincare suited to my skin for my age now. So, number 1, cleanse morning and night. Well, I wasn't doing that for sure, but now I am. Sharna takes care of my skin and she recommends CeraVe, which is cheap as chips. I do a double cleanse in the morning and splash with water, and I use a face cloth to clean it off. Onto a clean face, I then apply my serum. The one that's recommended for me is Illumire's Ultimate Boost onto a clean face. I was recommended Ultimate Boost by Illumire's to apply it every morning. After this, I apply a moisturiser. Any moisturiser will do. I use this one from Rhode. It's nice and light, and I wait a minute or two between each layer. Then I sandwich another layer on top, my sun protection factor every single day. Every single day I was advised by Sharna to use a Lumire Clear Shield, which has got an SPF of 47%. That's also nice and light. That is a non-negotiable. Even though I work indoors all the time, in my car I keep a factor 50 just in case that I go for a walk in the afternoon or in the evening time and it's still bright. So I wouldn't put the bins out in the daytime without making sure that there is a sun protection factor on my face and neck. More, really. And then just before I go out the door, I apply this Trini London BFF, which is a skin perfector. It's also got sun protection factor of 30, but it gives my skin that lovely sheer glow, which is not too shiny. Now on to nighttime. I double cleanse in the evening time with CeraVe, cheap as chips, and I use a face cloth. And then I apply tretinoin onto clean skin. My skin currently can tolerate 0.5%, but you can start with 0.25% and then gradually build it up to 0.5, and it could go up as far as 1, but that's too irritating on my skin. So extra to this, I have hyaluronic acid skin booster injectables to hydrate and plump back my skin, which was lacking luster, and this whole post-menopausal aging. I use the gold standard Bellaterra Revive 1 ml on each side of my face. Initially I needed 3 or 4 treatments monthly in order to get any kind of plumpness back into the skin, and now I maintain it every 6 months. It's 6 to 9 months, but I need to keep on top of it. And very occasionally I use Restylane, which is also a hyaluronic skin booster, and in between, if I feel that I have to wait for the Bellaterra Revive, I might even do a treatment of Profilo on myself as well. All hyaluronic acid, some are longer acting, some are shorter acting, and it keeps my skin with that dewy look. So our skin, and we're at the mercy of it, is going to receive hyaluronic acid skin boosters in different way. It depends on how old you are, it depends on how dehydrated your skin is, and you have to keep coming back to have more and more in order to keep that lovely plumpness going. If my skin is looking particularly tired, or if I'm in the central heating a lot, or if I'm out to the elements, I usually sort of top up with a dose of Profilo, which is in 5 injection points in the face, and I use it on my neck as well. Okay, so what else have I had done? Do remember, we are aging all of the time, every second of every minute. So extra to this, I've had some cheek filler put into the cheek here to lift the skin off the nasolabial folds here. I've also had some filler put in front of my ear here in order to pull the skin back off my marionette lines. So lips start to disappear as you get a bit older, so I've had those plumped and hydrated with hyaluronic acid fillers from Bellaterra lips, and the periorals and the barcode lines I inject every 6 months, or get them injected every 6 months with Galderma Kiss. I don't have it here. So onto crow's feet, I get Botox here, and also in the glabella, which is done every 3 to 4 months, and I have 3 to 4 weekly targeted facials specific for my concerns. Crepiness and skin laxity, dehydration, sun damage, they bring the most common issues, which are all normal for my age and my neck. I have started polynucleotides recently in order to sort of turn back time. That is 3 injections every 2 weeks, and then it peaks at the 2-month mark. I've had it done in my neck, my 62. It could be a bit late for my neck, but I'm going to give it a go anyway. And I'm also having polynucleotides around my eyes as well. Is it too late for me? I don't think so. I think the only thing in time for my neck will be a lower facelift and an upper neck lift. I was injecting it with Profilo to reduce the crepey look, but it's not as effective now as it would be with a surgeon's knife, and that's what will sort that out in time. But in the meantime, while I'm waiting for that, I do polynucleotides and Profilo. What is the best surgical anti-aging treatment at the moment is an upper blepharoplasty. That's where the skin with the upper part of your eye, when that gets very heavy and it sits on your eyelid, it tends to make you look tired and aged. So you need to get a good eye surgeon in order to be able to do that for you. And that is a surgical but day-only procedure. So there you go. That's my routine. It took ages. It took 2 to 2.5 years, and I have to stay on top of it. Every month I am keeping on top of it. And it's not happenstance. Clean eating, although that helps, and drinking lots of water, that helps too. But I don't smoke. I don't drink that much. I barely drink alcohol at all, actually. I walk in plenty of fresh air, and we're lucky here in Inchydoney. But sun protection factor is my friend, and I am lucky to have Sharna in the room next door to me here at the Aesthetic Clinic in Clonakilty, who can do as many treatments as I can. It's taken a long time, but because I'm aging every minute of every day, I always manage to stay on top of it without surgical intervention for now, but the injectables will keep me going in the meantime. So will I be going down the surgical route in time? Oh, I would imagine so. But for now, we're managing to keep it going. I hope that helps.